Governor Jeff Landry is expected to sign a bill that would classify a pair of commonly used pregnancy drugs as dangerous controlled substances. The measure has inflamed passions and propelled our state into national headlines. The Louisiana legislature passed a bill to reclassify mifepristone and misoprostol, two drugs which can be used to induce abortions early in a pregnancy. Both pills are at the center of a national debate regarding the legality and accessibility of abortion tools in the United States.
The Supreme Court just finished hearing arguments in a monumental case threatening access to medication abortion in the U.S.
Turning now to the Supreme Court, the justices just wrapped up oral arguments on whether to uphold broad access to a pill that's commonly used for abortions.
Now to the battle over abortion rights before the Supreme Court on Tuesday, almost 2 years since Roe v. Wade was overturned. This time, the focus is the pill used in more than half of all abortions in the U.S.
Senate Bill 276 would reclassify both pills as controlled dangerous substances, which is a class designated for medications with addictive characteristics, similar to opioids. This new classification would mean the pills are inaccessible without a prescription, and that they'll be heavily monitored once prescribed.
This bill would be, scheduling medications that just have really no abuse potential.
Dr. Smita Prasad and Dr. Sarah Hamway, medical doctors who specialize in treating those suffering from addiction, say the scheduling process is how doctors categorize drugs based on potential for abuse or dependency. If mifepristone and misoprostol are added to the list, it could complicate a doctor's ability to treat patients facing life-threatening pregnancy complications.
Having a controlled substance in a facility requires a lot more red tape, paperwork, overhead, documentation. It overburdens an already overburdened system unnecessarily. Like I said, these medicines are not being used for any abortive purposes.
Both pills are commonly used outside of treating miscarriages or abortions for things like insertion of IUDs, conducting uterine biopsies, and even to treat hemorrhaging.
In the cases where these are life-threatening situations for people, and this is in no way associated with any type of abortion or termination of any pregnancy. And those medications have to be readily available on the spot. And we don't need anything in the way of that, of trying to save those lives.
But even more concerning for the doctors is the precedent it could set for scheduling medications in the future, a concern echoed on the Senate floor Thursday as lawmakers questioned why politics should be involved in medicine.
I disagree with Senator Presley about the law and what it is. The law is pretty straightforward, I believe, in Title 40, where it says, the Secretary shall add a substance as a controlled dangerous substance. That's the Secretary's job. It's not the legislature's job. And why is that? Because that takes the politics out of it.
Senator Thomas Presley, the author of SB 276, cites a personal anecdote of his pregnant sister being given the drug combo without consent to induce an abortion as a reason for his legislation. He claims scheduling drugs wouldn't keep women from accessing the pills.
What happened to Catherine was tragic. It was terrible. It was the worst experience of her life, my life, and my family's life. I don't want that to happen to other women. I also don't want women to not be able to get the health care that they need. When it's prescribed for a legitimate healthcare purpose, women will be able to get these pills.
Proponents of the bill say adding the pills to the controlled substance list could reduce the risk of the pills being used for abortions, something already illegal in Louisiana through the 2006 abortion ban triggered after the Supreme Court's Dobbs decision.
Doctors will have exactly the same prescribing authority as they have without the bill. Right now, they have to get a doctor's prescription to get this medication. After this bill, they will have to get a doctor's prescription for this medication. The difference is that it will be harder to illicitly traffic in illegal drugs. That's all the bill does.
But opponents of the bill say the legislation could further degrade Louisiana's already poor maternal health outcomes.
We should prioritize safe and evidence-based care for pregnant women. That is not what's being done here. We are not prioritizing safe and evidence-based care for pregnant women. We're using politics to decide how to govern care for women.
The bill, now advanced by both the House and the Senate, will make its way to the governor's desk for signature. Governor Jeff Landry has already implied he will sign it into law.